your home, it's your dream. Radon testing, keep it healthy and clean. Make it green, green, green.
Making it green starts from the ground up, so make sure the air in your home is healthy for your family to breathe. Test your home for the presence of radon. Go to epa.gov/radon.
Make it green, green, green.
And this is, again, this is kind of some of the images that I'll see on the computer system when I'm doing some of the burring. And it's a pretty neat neat thing to see. I have a 3-year-old, and I'll see him playing video games on his little computer, and I think about sometimes when I'm at work, it seems like that's what I'm doing.
He'll make a good
so he'll be ready, that's right. So the Rio, that's the robot. It assists the surgeon in treating.
I'm sorry.
That's okay. It helps the surgeon achieve the natural knee range of motion and allows a level of precision that we previously could not attain prior to this with conventional instrumentation. It's patient specific. It's with the preoperative CT scan that we get. The intraoperative guidance and knee balancing, that's what I'm doing during the surgery. That's why I don't go play golf when you're having the surgery and let the robot do this thing. Let's see here, the next slide. This was a video of it. I don't know I'm going to be able to get that. I don't think that will come up. So what are the benefits of doing this versus, have we seen that this is beneficial to our patients? And that's the most important thing as a surgeon. Are we getting any benefit from this fancy technology? And typically what we see is that we are able to perform the surgery through a smaller incision than a traditional knee replacement surgery. Only the arthritic portion of the knee is sacrificed. We help preserve the healthy bone and tissue. The implants are positioned where we need them to be. So they're optimized with regard to their position and placement, allowing the knee to perform like it should perform. Potential benefits, we've seen improved surgical outcomes. Because we put the implants where they need to be, we have seen less implant wear and loosening. That's what affects the lifespan. If you start to wear the implant out or it starts to become loose, that's what judges the lifespan of an implant. And so if we get it in perfect position, they last a lot longer.
How are they secured?
That's a good question. So basically the bone that we burr away with the robotic arm, we replace that bone with metal and plastic. The metal adheres to the bone with a high intensity bone cement. Okay? So basically when the pieces of metal are adhered to the bone, then we slide the piece of plastic that attaches to the bottom part of the implant. We've seen obviously we can preserve a lot more bone. We make smaller incisions. There's less scarring. It's reduced blood loss. Usually with total knee replacements, it's not uncommon to have to need a blood transfusion. It's very rare to have that in this procedure. There's minimal hospitalization. Like I said, most of my patients go home the next day. Rapid recovery, it's less invasive, and the knee feels more natural. And we'll talk about that in just a minute. One of the physical therapists commented on that. But like I was telling you guys, with a total knee replacement, it is oftentimes up to about a year before my patients will come in and they'll say, you know, doc, finally, this knee finally feels like it's my own now. Whereas these partials that we do with the robot system, it's a lot sooner. You're talking about on the order of a few months. They're like, doc, this thing feels just like new. And so that's a major difference that we've seen there.
Well, Dr. Smith.
Yes, sir.
If you do the partial, it takes up to 4 weeks to get over it. After that time, can you climb a step ladder or,
No,
I mean, when can you do that?
yeah, and so what I normally will tell my patients for normal healing or for normal activities such as walking and just daily activities where you're walking without the assistance of a walker or a cane is usually that 4 to 6 week period of time. For activities such as vigorous activities, which I would include like tennis, ladder climbing, repetitive squatting, things like that, you've got to allow time for your quadriceps muscles to heal and strengthen. And that usually takes an additional 6 weeks. So that's about a 3-month time period that we're, especially if you're wanting to do something that's high intensity exercise, whether it's tennis, whether it's bowling, whatever you like to do, or work specific, such as climbing ladders, or you're a mechanic and you got to get down and on your knees and so forth. So we've got to allow a certain period of time to allow the muscles to get stronger, but from a standpoint of the actual knee being functional to where you can do all your normal activities, that's within a 4 to 6 week period of time. If you were, like I said, if you were an athlete or you're wanting to get back to a sport, I would probably, and that's just me being cautious, it's not that you physically couldn't do those things, I just would prefer you waiting until the muscles build up their normal strength.
But I mean, if we have this done, you'll tell us.
Oh yeah, yeah. No, my follow-up on my patients is pretty close with any surgery I do, but particularly for this type of surgery, we always watch the implants. We want to make sure that they're staying in the same position. So what I normally will do is have my patients see me at 2 weeks after surgery, then at 6 weeks after surgery, then at 3 months after surgery, 6 months after surgery, and then a year after surgery. And we're getting x-rays all during that period of time just to watch the implants and make sure that they're staying where they need to be. Also, I'm getting reports on a regular basis from our physical therapists. We start physical therapy very early, either as an outpatient or having them coming out to the house for the first couple of weeks with home health therapy. And I'm staying on the phone with them, getting reports from them on a regular basis to keep tabs on how well you're doing and what progress we're making or not making. You know, if there's a complication, we've got to know all that. You know, if you're getting stiffness in the knee, we got to be able to work through all that. So that's a great question. So who would be a good candidate for the makoplasty procedure? As I said earlier, each treatment is going to be individualized, so not everyone is a candidate. This is a great technology, but there is a specific window of patients with specific arthritis that are candidates. Not everybody's a candidate. Some findings are consistent with patients that are usually a candidate. Knee pain with activity on the inner knee, like if you say, Doc, you know, my pain is always here. That's a trigger in my mind. Hey, maybe this is a person that has some isolated arthritis. Let's get this worked up, get some X-rays, and take a look at it. So pain with activity on the inner knee, under the kneecap, or on the outer knee. And if it's in all those locations, then like it may be more advanced than what we expect. So you may not be a candidate for it. But if it's isolated, that's a good sign that there may be just some isolated arthritis. Startup knee pain. What we mean by that is if you're sitting like you are for however long we do this talk, and you just get up and you're starting to have pain when you get changed positions, we call that startup knee pain. So that's a very common thing that we'll see with patients with mild to moderate arthritis, even sometimes severe arthritis. Failure to respond to non-surgical treatment such as rest, weight loss, physical therapy, non-steroidal anti-inflammatories. One thing you'll learn about me, especially if you come to see me for a problem like this, surgery is not going to be the first thing I offer you. Okay, there are a lot of things that we can do that can be very helpful from a standpoint of controlling your symptoms that may prevent you from needing surgery. Okay, so I always think that's the safest and the best thing to do is try these other measures first. But if you fail those measures, you've had several injections, you've had the physical therapy, we've done the bracing, we've done things that we know are the good conservative measures, and it doesn't work, then that's when the surgery is a consideration. So here's some X-rays, and I'll kind of point out to you. This knee here, they were complaining mainly of pain on the inner part of the knee. Okay, that was isolated. Their isolated complaint. I looked at these X-rays, and basically you can see here I'm going to point out to you guys, can you see the space between this is the thigh bone, okay? Thigh bone, leg bone. The space between these bones is our knee joint. The space should be fairly uniform and it should be fairly smooth. The edges of these bones should be fairly smooth. When the space starts to narrow or the bones become irregular, that's a sign to me that there's arthritis in that part of the joint. And so this part of the joint actually over here looks really good, nice and healthy. But if you look here, you guys can see how narrow this joint line, you see that black line, how it just kind of thins out right in that area? That's the bone getting closer to itself. That's because the cartilage is wearing out. Cartilage doesn't show up on an x-ray, and that's why it shows, you see this black space here. That's cartilage. So if the cartilage is thinning out, the bones get closer together, and that's what dictates to us that, hey, there's some arthritic changes going on here in the knee. So in this case, this was isolated what we call medial compartment arthritis, and so they had a medial compartment arthroplasty. And this is the metal component here is kind of encases the end of the thigh bone, and then the plastic component here kind of sits down into the tibia. Okay. Now this type of implant is a little different. We actually use this version here, where there's a metal component sitting on the tibia. This version here was an earlier version that we found that these tend to loosen a little bit sooner. So we use the metal version where we put a metal piece down here on the tibia. Can y'all see the difference there? And so the plastic that we put in there goes between these two pieces of metal, and that plastic functions as our cartilage. So, and then this was an example where we did the medial compartment, but we also did the patellofemoral. So underneath the kneecap, there's a lot of arthritis, and you can see the bright white sign right there. That's kneecap arthritis, and so that's why we replaced that as well. So here's some common questions, and we'll hit some of these too, some of your questions later. But how long can I expect the implant used in Makoplasty procedure to last? This is one of the most common questions that I'll get. All of the implants have a limited life expectancy. It's like any man-made product we can think of. There is a limited life expectancy. It does depend on several factors: patient's weight, activity level, quality of their bone, compliance with the doctor's orders, alignment. With all that said, all that's important. However, we found, like I talked earlier, the alignment and positioning are also very important. That's, in fact, the most important thing from a technical standpoint. Obviously, you've got to watch what you're doing and make sure you get the wound to heal and try not to get it wet and decrease our risk of infection and things like that. Those are things that as a patient, we can help minimize our risks. But as the surgeon, we're looking at the technical aspects of it, and that's where this robotic surgery can really help us out there. So the goal of the Makoplasty is to achieve the absolute best alignment and positioning so we can get the longest lifespan possible out of those implants. Now those implants, when they're positioned appropriately, they can cycle, and we've seen them with a lifespan up to 20 years. I've got a patient of mine who had his done, a partial knee replacement done many years ago. He's going on 20 years now. And obviously we didn't have this kind of technology back then, and I didn't do his surgery 20 years ago. But he actually had good position implant placement, and he's still going on it. I've actually done a total knee replacement on his other knee, and he's still doing good with the partial knee replacement. So I will say this though: he's thin, he's active, he's healthy, and otherwise has been real compliant with his knee. So there's a lot that plays into that. I think that my recommendation usually is if you've got isolated arthritis, the partial knee replacement is a good option, for the main reason that you don't really burn any bridges. If you do have a complication with it and it does loosen after 10 years or 15 years or whatever the case may be, you don't burn any bridges. You can always go the route of the total knee replacement if need be. So that makes another advantage to it.
Dr. Smith?
Yes, ma'am.
When I told my brother, who is a doctor, about my condition.
Mhm.
And I told him that it hurt on the inside of my knee, and that's where you dealt with my knee.
Mhm.
He said, that's very unusual. He does not know what you know. He's not that kind of doctor.
Okay.
But he said that's very unusual because it's usually men that have the inside problem.
Now, well,
and the outside.
he's actually on to something there. So basically, what you're getting at though is the way men and women, their alignment is usually different.
Right,
Okay.
that's what he was saying, the way they walk.
That's right. So men typically will have what we call as a varus knee, and that's where their inside part of their knee will start to wear out before the outside part
Right.
does, and that'll give you that little bow-legged appearance. That's what we call as a varus knee, and so that's what he's referring to. That's more common to see that in men. Now, women can have either, obviously, can have either direction, but we do see where women tend to get a little more valgus, and that's where you get a little more knock-kneed appearance. It's not the bow-legged, it's the opposite. You get a little knock-kneed appearance. And so that, he is exactly right. Yeah, but I think what he was probably gathering is that he was more talking about our alignment as males and females.
Right.
And so, now with that said, just because you may be prone, if you're a female, and you may be prone to have the knees come in, doesn't mean you can't still have isolated arthritis in one location. And so that's the thing to kind of make sure of. So,
Well, you want to know what kind of doctor he is?
sure.
He's a dentist.
Okay.
73
Fair
years
enough.
old.
Well, you know what? I'm very impressed now that he was a dentist and knew that. That's good stuff.
Dr. Smith,
Yes, sir.
I done been to you one time, and when I get up out of the chair or off the commode, if I put my hand on my knee, it sounds like rocks under there.
Yes. Chances are it's that's what we call that. That is crepitus. Okay, crepitus is that grinding sensation that you feel in your knees. 9 times out of 10, and what I will do oftentimes is in the office, I'll put my hands on the front of the knee and make that knee go back and forth, and you can feel it.
Yeah.
If you have that, 9 times out of 10, it's because of arthritis underneath the kneecap or in the groove where the kneecap travels. So that's very very common to see. So with that said, X-rays can certainly tell you that and lead you down the path. If you've got isolated patellofemoral arthritis, or if you've got other areas that are affected, then that would show up on the X-ray too. So, all right. So what are the benefits of this new technology? We've talked about some of those. It's minimally invasive, more rapid recovery, natural feeling knee. Results have shown that it potentially allows for patients to experience a shorter hospital stay, minimal blood loss, quicker rehab, and a smaller scar. In addition, many Makoplasty patients are able to return to an active lifestyle within weeks of their procedure. I like this. One of my physical therapists sent me this picture. And what are the benefits of this new technology? I always say, this is what we want. And although this is a nice walker, we want to be independent. We want to maintain our mobility and maintain our active lifestyles. So here's some comments from various patients that have had this done. It's fun to read through these. The pain was keeping me from walking. I couldn't walk, but from one room to the next. This is such a pleasure to have this surgery, and recuperation was so speedy. My physical therapist says she has never seen such rapid muscle response. I was recently able to walk 3 miles, and that included some hills. I had no difficulty with the knee. This is an interesting thing to say, and the reason that the physical therapists, they don't see this kind of rapid muscle response is because we're not messing with the muscles. We're isolating the surgery we do to the affected area. So that's why it's such a rapid recovery. Sometimes when I'm walking, it feels so comfortable that I have to stop and think which knee has an implant. That is the point in time when you know that knee is yours, and that's that comfort zone. And most of our total knee replacement patients will get to that point, but like I said, it's such a long period of time after, almost up to a year. I'm now able to go up and down steps without holding onto the railing, totally pain-free. I no longer feel limited or cautious because of my knee pain and discomfort. Now I can do just about anything and everything I want, all physical activities except running. And I will say that that's one of the controversial areas that I try not to encourage. Running is a high-impact activity. Like we were talking about tennis, I have some, I can't.
Step ladders.
Step ladders is not as high impact, and it's probably okay. But as far as if you were jumping repetitively off that step ladder and jumping down, I would say that's a no-no. Jumping and running are typically, that's the way to wear out the implant the fastest. So, any questions?
Stay off of the treadmill.
Well, the treadmill is actually good if you're not doing a lot of high impact. The walking on the treadmill is certainly fine. But if you're doing jogging or running, it's kind of like jogging or running anywhere. You're putting a lot of impact there. So, any other questions?
So I have to give up my jogging, huh?
If you were to have that done, I typically don't recommend that. It will wear out that implant a lot faster if you're doing a lot of high impact stuff.
Well, Dr. Smith, I ain't been able to squat in a long, long time.
Well, I tell you, and squatting is from what you described to me is that is the arthritis underneath the kneecap. That's what's preventing you from doing that. Is squatting, stair climbing.
Yeah.
Oftentimes, that's what you'll see with pain and arthritis underneath the kneecap. Difficulties doing those types of
It
activities.
seems like when I step off a curve up on the sidewalk, I have to almost jump to get going.
Yeah.
And your point is, we all do that.
Well, I think we have a tendency to tell ourselves, well, that's just a normal thing. I should expect that as I get older or whatever. But that's not always the case. If it's something that's bothersome or getting in your way or causing problems with your knee, get it checked out. It's there's a chance that, first off, it may be something very easily taken care of that doesn't require any of this surgery that we talked about. It can be something that, with a little cortisone injection or some little physical therapy or just doing some things that are non-surgical that can be very helpful. So don't feel like you got to live with it. Yes, sir.
Dr. Smith, I got a neighbor. She had both of her knees replaced at one time. And she didn't have no problems. And she said she knowed that. She'd done it 20 years ago.
Yeah. And I will say with my patients, whether they're the partial knee replacements or total knee replacements, that's a very common thing. It's most of my patients are, especially that 1 year out, they usually say, Doc, I wish I would have just had this thing done many years ago. And I think our tendency is we just kind of try to deal with things. It's our human nature to just try to deal with the pain and kind of push through and keep doing your thing. And the point is there are some very good things that we can do to alleviate that and help you preserve your activity and your lifestyle. So, yes, ma'am.
You know that the steroid shots are not good for your bones. Excuse me. How long is it safe to take the shot?
That is a great question. And you'll see a lot of literature out about that. And what I typically will tell my patients, I'm very conservative. I limit the number of injections that I'll do for a specific problem. I will normally say no more injections than one every 4 months. So basically 3 injections a year is about all we'll do.
But for how many years?
Well, and there hasn't been anything shown that you couldn't do that for 10 years. The point is that the small amount of cortisone that we put in, we're not repetitively putting that in every 6 weeks. Okay, your body has time to eliminate it, and I always say it's cortisone is like anything. You can get too much of a good thing, and cortisone is definitely one of those things. And so you've got to be very cautious with it. But if you're getting an injection once every 4 or 6 months, we haven't seen any major issues with bone strength or anything like that.
Dr. Smith, you gave me one some time ago.
It's been a while.
Huh?
I think it's been a while.
No, it ain't been all that long.
A few months.
No, it's been sometime between now and the other side of Christmas.
Okay, so
But anyway, I ain't never had no problems hurting. It just, it feels like when you get up off the commode, it feels like rock to rock.
Yeah.
Or a chair. And seem like when I'm going down steps, if I don't hold something or take one step at a time, it feels like it ain't gonna hold me up.
So what you're describing there is you're still having the mechanical symptoms, even
Right.
though the injection has helped with the pain. The mechanical symptoms are still there, and that's what we've got. We need to get back together at some point. And we need to
I
take a
ain't got
look
an
at it.
appointment with you.
All right, good.
Why are you a sports doctor?
Well,
It says sports doctor.
yeah, my specialty is sports. Basically, sports involves knee and shoulder is kind of our specialty areas. When you see someone that's a sports, we have several sports guys that are in our practice. Sports involves a lot of knee and shoulder work. Basically, I did an extra amount of training to get that sports training. I, like other orthopedic surgeons, still will do a lot of fracture care, the joint replacements or hip replacements, and fracture care like trauma. You know, a lot of hip fractures and ankle fractures and things like that, wrist and forearm fractures and so forth. We still will do a lot of those surgeries as well. But kind of my area of expertise is knees and shoulders, and so pretty much any surgery around the knee or shoulder is usually what we would specialize in.
Well, I will be your challenge because I have a titanium rod in my right leg, my femur, and hardware. And you didn't know if you could cut off the femur.
That's right.
So,
well, as far as doing the knee replacement surgery,
doing anything, I have arthritis.
Yes,
I know.
that's what I'm talking about. Because when you're doing a total knee replacement, if the hardware goes too far down, then that's what you've got to worry about. Well, is your knee going to tolerate that?
Right.
You know, and are you going to have enough bone to work with? So that's always a challenge. You're right.
I know. I'll be your challenge.
Yes, sir.
Dr. Smith, do you do that here at this hospital?
Yeah. Oh, that's a good point. That was a good question. So. Where do we do this surgery? Our practice, all of my partners who do this, myself and I think there are 3 other guys in the practice that will do this surgery, we all do them here. We are one of, I think, 4 hospitals in the state that have the robotic technology. There's one on the other side of Atlanta, there's one in South Georgia, and I think there may be one in Savannah or somewhere. I don't think Augusta has one. Anyway, we're the kind of the closest robot to this area.
Okay.
And even the Athens hospitals, they don't have that. So a lot of our guys in the Athens area will come over to do the surgery here. So.
Okay.
Yes, sir.
Is there any real benefit from any of the supplements, joint supplements?
That's a great question. Yes, there is. Now, some people get a lot of benefit from them. Some people get very little benefit. So again, that's one of those treatments that's going to be very individualized to your specific problem that we're treating. So the supplements that we're talking about, the glucosamine and chondroitin, that's the one you'll hear most about. I think is a very good joint supplement. And there are different ways that you can take it. There are liquids and pills, and they've got a variety of different things that you'll see in the pharmacies and so forth. And certainly is a good thing. We've seen that it's more effective for patients who have mild arthritis, mild to moderate arthritis. Once you get severe, it's not as beneficial. The other types of injection, we've talked about cortisone injections, but there are other types of injections that we do also that can be helpful. They're called viscosupplement injections. It's basically where we're kind of injecting cartilage nutrients into the joint that gives some bolstering effect to the cartilage that's there, to the healthy cartilage that's there. So you may have heard of Synvisc, Supart, some of those types of injections. And those can be helpful also. All right. Well, good. Thank you, guys. I appreciate y'all coming. Yes, ma'am.
I have one other question. What about the injection from the rooster?
That's what I'm talking about. Yeah, you hear the rooster comb injection. That's exactly what we're talking about. That's viscosupplementation. It's Synvisc, Suparts, a lot of those injections, and that's where it's high albumin is another.
Is it with your patients? How many have had success with that?
It's about 60 to 70% will get long-term relief for about a year or more. So it's fairly good. The problem is that it's very expensive, and there are a lot of insurance plans that just won't cover it at all. And it's a shot that can cost up to several $100s. So what I normally will do is, before we go that route, I will try cortisone and see if that is a successful regimen that we can try. If it gives you temporary relief and we see that the Synvisc is something that we need to try, then we'll get it approved with the insurance and make sure it's covered before we try to embark on that expense. So, but that's very, very good options for us, and we do see that a lot of people get good relief from it.
Well, thank you so much for coming, Dr. Smith. And if any of them want to follow up with an appointment with you, what is the number at the office that you can reach
yes,
you
I had. Now so 770-267-0978. That's our office number. Now it'll ring into it should transfer over to the Athens office, and all you got to do is say, "Hey, I want to see Dr. Smith in Monroe," and they'll get you set up for that.
Loganville.
Or Loganville, wherever's convenient. We see patients in Monroe, Loganville, and Snellville, and also Madison. So we've got kind of 4 offices out in the western hemisphere is what we call it. So, and then of course we've got offices in Greensboro, Athens, and then north of Athens as well, in Royston and so forth. So, all right, guys, thank you all again for coming out. I appreciate it. It's good to see y'all. Yes.
Good morning. Thank you for watching. I'm Dina Huff, Executive Director for the Partnership for Families, Children, and Youth, and I welcome you back today. My guest could not be here today, so I told her I would jumpstart her presentation because she will be on the next time we film to kind of give you a follow-up on what I discussed today. But that's Miss Teresa Thompson with the Walton County School District, and she wanted me, she's the Title I Parent Coordinator for the school system, and she wanted me to give you some important information that parents need to know if your children attend the Walton County School System. So I'm going to read to make sure I don't get anything wrong here. The parent satisfaction is a priority of the federally funded programs in Walton County Schools. And each year, the Title I and Title II federal funded program require the school systems to conduct a needs assessment survey, which is very important for the parents to fill out. The results of this survey will be used to write the Title I and Title II improvement plans. These improvement plans define how budgeted federal dollars will be used for the FY 13-14 school year are used. Parents are strongly encouraged to complete this survey, as your answers will help us decide how to best use federal money. All answers that you send in will be confidential. The survey should take about 6 to 8 minutes to complete. This survey is located on the right side of the Walton County School District homepage under Parent Needs Assessment. The survey link is highlighted there. The Walton County School District web address, I will give that to you in just a minute. And the school district values your responses to the survey questions and appreciates your support. Now, if you have any questions about this survey, you can always call Ms. Thompson, and her number is 770-266-4495, and she is actually located at Youth Middle School, and her email address, if you choose to email her, is tmthompson@walton.k12.ga.us. And she will be on with me next time just to kind of talk about this and talk about how important it is for all parents to complete this survey, because it's a huge need in this county. We have to know what the parents' needs are. What do you want for your children? So please, I encourage you to go online, and if you don't have access, please give Ms. Thompson a call if you don't have access to internet, and we can find a way to make that available to you through some of the schools, maybe through the library. So please give Ms. Thompson a call. And if you have any questions for the partnership, our meetings are the third Tuesday of every month. at 8 a.m. at Felker Community Center. We would encourage all community members to come. If you're just interested in knowing what we're about, what we do, please feel free to come and visit. Everyone's welcome. We don't, we have no limitations as to who can attend our meetings. It's open to parents, students. We encourage all family members to attend. So as always, thank you for watching, and we will see you next time. Thank you.
Hi, I'm Molly Kimlow with the University of Georgia Cooperative Extension here in Walton County, located in downtown Monroe. Today, I would like to talk to you about the program that happens every year, Walk Georgia. Walk Georgia is a wonderful program. It's a virtual walk through Georgia. What that means is you don't have to actually walk the whole 59 counties by foot. You're actually walking virtually on the computer, and it's a lot of fun. You can do this as a family, as a team of 4, or you can do it individual, either way. But Walk Georgia will begin. Registration starts February 1st, so it's already started. You need to get registered for Walk Georgia. The virtual walk through Georgia starts on February the 10th, and it goes through May the 4th. What will you do during this? Anything from yard work to housework to walking at work, go out at lunch. That's what we need to do, is to promote that we need to get out and move more as Georgians. We need to get out, exercise, move more, just be active. I'm right now at Felker Park here in Monroe. We're very fortunate in Walton County that we have so many different parks here. We have passive parks that we can walk through. We also have parks like Felker and Meridian Park and the Park and Social Circle at South Walton that we can go and exercise and walk. Right now, and I'm here, and they're also doing some classes here, and we just looked in, and the class is absolutely full. They look like they're having a ball. They have so much fun moving around as they walk and exercise. You can do that with Walk Georgia. You can do that and walk, get up, move around, and get active. We have a problem in the United States with obesity. And if we would get up with our children and walk around, drink water as we're walking, not Cokes as we're walking. You don't know how many times I'll see people out walking around and they've got a drink, a soda with them. And that's not good. We need to make sure we get out and walk with water. Keep yourself hydrated. We don't, even on cold days like we're having now in February, some cold days, we still can dehydrate from wearing layers of clothes. But if we would just get out, get our water, drink a little water as you're going, and get out and walk. We're going to see some more really warm days and some warm hot days even. I get out lots of times at lunch in downtown Monroe and walk around for about 15 or 20 minutes. That gets logged on to my Walk Georgia. I might go to the gym. We're fortunate we have several gyms here in Walton County. You can go to the gyms and walk and exercise. On Walk Georgia, you can do the elliptical, you can do the exercise ball, you can do yoga, Pilates, there's all kinds of things you can do. But what we want you to do is to get up and move. Now, if I've told you nothing else talking to you, we need to get up, move, and be active. And we can do that with Walk Georgia. Just go on the internet to walkgeorgia.org. That's all you have to put in. You log on, you go to the place to register, you register your team, register you as an individual, but you are going to register and then you're going to have your Walk Georgia team. When you go on, you can look and see the top teams in Walton County. So you can see you're on there, or your top individuals. You'll see your name on there. So it will make it a lot more exciting when you start seeing people on there that you know, and it makes that challenge a little bit more. If you're at work, get a team from work. We have several teams from Advantage Behavior, from Unlimited Services, from the schools. Last year we had the Tree Cutting Cowboys that walked away with it. They were fabulous. They walked all over Georgia. Our goal is to get through all the counties in Georgia. You can start in Dade and go to Ware County, or you can start in Walton County, Fulton County, anywhere you want to start, you can start and get, the goal is to get through all the counties. Every 15 miles of virtual walking, you get to move to a different county. Then you get to learn something about the county. It might be about the agriculture, it might be places to shop, it might be parks there. I had somebody one year tell me that they found a vacation place. They couldn't go on vacation that summer. And they found a place and they used it as a staycation, and they still got to go on vacation and they stayed at home. So you can do this too. You need to get up, get moving, and walk Georgia. So let's remember, we want to move more and live more, live longer also. We can do that by walking through Georgia. So I'm fixed to put on my tennis shoes, and I might take a few minutes and walk on the track. Have a great day. If you have any questions, call me at 770-267-1324 at the Walton County Cooperative Extension. Get out and go to Walk Georgia, walkgeorgia.org.
Hi, and welcome to this week's edition of The Health Story. My name is Dee Dee Harris, the Executive Director of Walton Wellness, a nonprofit located here in Walton County dedicated to the prevention of lifestyle-related chronic illness, focusing on diabetes and heart disease. Each week I like to come to you with some kind of tidbit of information or a resource that might be available that you may not know about, anything that might be helpful to your health journey in your life or someone that you love. And today I just want to talk, we've passed the holidays. I've done a lot of talking about the flu and the illness, and hopefully we are actually through the peak of the flu season, and we should hopefully be starting to see a lot of us getting well from all of this, what I like to call just the crud. That isn't necessarily the flu, but it just is, everyone's getting stopped up and those kind of things. So we should hopefully be heading more towards the well season as it does start to turn our seasons a little bit. So I wanted to talk to you today a little bit about looking towards warmer weather and thinking about your exercise. Now, I like to talk about exercise a lot. Some of you may know that I do exercise. One of my favorite things to do is spin class, which I do a lot, because one of my favorite things to do is to ride a bike. I don't often get to go outside and ride a bike. I just don't have the time, so I actually go to the gym and take spin class and do working out and that sort of thing. But what I wanted to talk to you about today was that you don't have to go to the gym. I actually wanted to talk to you about incorporating daily activities as exercise in your life. Oftentimes, when people start thinking about wanting to get in shape or lose weight or something, they think, oh, I have to go to the gym. And so what I wanted to share with you today is that you don't necessarily have to go to the gym, because there are all kinds of ways to incorporate exercise into just your daily life. Just for example, going to the store, whether it's Walmart or the grocery store, just think about parking a lot further from the store. Try to find, it doesn't have to be the furthest parking space, but try to find a parking space that's not as close. Don't be the person that's driving around waiting for the person to leave that has the closest parking space. Actually park away from the store so that you can get a little bit more exercise just walking into the store. Also, you can incorporate just regular exercise walking around at home. One of the things that they say is we sit too much. We're sitting eating, we're sitting watching TV, we're sitting on the computer. We're often sedentary during the day. So it is important to think about just getting up, just moving around, walking around. If you're at work during the day and you have an office job, think about just getting up and walking around your desk, or just standing up, even being able to do just exercises that you can do next to your desk. If you consciously think about at least every hour getting up and moving, you'll be surprised at how much activity that will actually put into your day. Even oftentimes when you are at home, let's say, not necessarily for dinner when you're eating with the family, but if you're eating lunch or having a snack, standing instead of sitting while doing that. Even standing if you're going to watch a show. try standing, watching some of that show instead of sitting. What is happening with us in society, as we've talked about before, is we are sitting so much, and if we would just try standing a little bit more, that actually exercises your muscles and your body more than it does sitting. It helps everything actually be in a line a lot more than sitting all day. So what I want you to think about is, how can you incorporate exercise just into your daily life? Not having to necessarily go to the gym, or not having to go out and run 5 miles or a mile even. Those things are good, and I encourage you to do those things, but there are all kinds of ways. If that's not your thing, if you're not going to find yourself at the gym, if you're not going to be out walking, and maybe you just don't have the time right now to do that, think about all the different things you can do throughout the day. Every time you're sitting down, think about, could I stand up? Could I be walking around? What could I be doing right now instead of sitting the entire time? There's all kinds of creative ways that you can be healthy in your life that sometimes we don't think about, because we're always hearing about people going to the gym or having to go run or walk or something. But there are all kinds of ways to incorporate health into your life, even when you don't think you have the time. As always, if you want more information about Walton Wellness, you can find us on the web at waltonwellness.org. You can also find all of our contact information there as well. But if you want to get me the old-fashioned way by phone, it is 770-313-8107. Thanks for watching.
At my office in recent months about trash on the side of the road, but we did have a letter that came in to the chairman's office, concern of a citizen here about our roadsides, and I just wanted to share a little bit of information with you all about how we work here at Keep Walton Beautiful. We don't just have people that go out and pick up trash. We don't have people employed to do that. We work through volunteers. That's what I work through with my program here with volunteers, and we do have an Adopt a County Road program where people can adopt a road through the county, and we have that information here, and it's also on our website. Now, the state of Georgia has kind of put a moratorium on the Adopt a Highway program. We do have 2 or 3 active groups still on the Adopt a Highway program, but they are going through a lawsuit, and they have decided not to do any more Adopt a Highway programs at this point in time. So with the constraints on their budget, they don't have a lot of money, I guess you might say, to just hire people to go out and pick up the road. The same people that you see picking up on highways are the same workers that do the other jobs that are needed by the Department of Transportation. So personal responsibility is a must with litter. I mean, it's never going to go away. There are going to always be people who don't care, and we do everything we can here to try to educate and let people know that we are here. We're trying to get in, talk to school children, any kind of civic groups. There are just some people that don't care one way or the other, and they're always going to be there, and I hate that. But with that, it is what it is, and we have a wonderful sheriff's department, and we have judges that help enforce when people are spotted littering, but sometimes it's hard to catch them. We have people here in the county that if they do find a bag of trash or something like that, if they find any kind of identifying information, then they do get with the person that littered. And we also have these little cards that are available that if a citizen spots somebody littering, they can actually send that card or get it to the sheriff's department, and Sheriff Chapman will write the person who littered a letter. Now, he doesn't arrest them, but it does, I would think, get one's attention. I know it would get mine if I got a letter from the sheriff saying that somebody saw me littering. So I just kind of wanted to say that because it's a struggle, and we really do try very hard, and personally, I think, you know, our county looks better than some of the counties around us, and I've actually had some compliments recently. I will say one other thing about litter. In winter months, it's always worse because it's more visible, and the weather's worse. And when we use our sheriff has a highway detail that they get out and pick up roads, and our public works department supervises community service workers that are sentenced through the court system to pick up trash, but they can't do that when there's inclement weather. So in winter months, you're just going to see it a little bit more frequently. But anyway, I hope that I've explained this a little bit, and if anybody has any questions about it or concerns that they want to share, or even any ideas, we're all up for new ideas, and we're always ready to have new volunteers work with us on our educational programs. Thank you so much for listening, and have a great week.
Hey, I'm Isaac with Reboot Computer Company, and we're going to do the Reboot Tech Tip. We're going to talk a little bit today about security. Lots of security issues going on as of late. We've got a big one right now that was in the news about Java. A lot of people don't know what Java is. It's basically it's a programming language that's used on computers, websites, cell phones, all these little Blu-ray players, DVD players. A lot of this stuff all uses Java. So it's necessary in everyday life of computers. You know, the thing that has happened recently is that some hackers have figured out how to exploit the Java and go into computers or whatever, you know, whatever this Java is on, and do pretty much whatever they want to. So it's kind of like a hole that they've drilled through to get to your computer or whoever's. You know, so it's not like you can just get rid of Java. You've got to have it. You know, the biggest thing to help with that Java issue right now is to make sure your Java is updated. Java will come out with an update maybe once a month or something like that. You know, you use that update every single time. You got to have it, otherwise you're exposed. You know, to some kind of security issue. You know, there's another thing that happened recently in the news was that Zaxby's franchising, it wasn't actually Zaxby's franchising, it was a bunch of franchises that were hacked into, and credit card numbers were stolen, and it was a big deal on the news, and I believe it was close to 100 or 200 Zaxby's that got affected, and some here locally actually. Not the one in Monroe, but I know Conyers and some surrounding cities were breached there. You know, there's not a whole lot, you know, us as consumers can do, you know, pay with cash. You know, luckily a lot of times when things like that happen, it's not, the consumer doesn't get the backlash from that. Basically, it's not the consumer's fault. You know, the credit card company either takes the hit from it, or, you know, Zaxby's would take the hit from it. You know, but it always leads to higher rates, or, you know, price increases or whatever. You know, the key thing here again is, you know, security is key. You know, have antivirus stuff, have a firewall. Windows itself that everybody uses pretty much on their computer has a firewall built into it. The firewall is just designed so people can't come into your computer whenever they want. Always make sure that thing is turned on. It's in the control panel under a little security icon, or on some versions of Windows, I think it's actually under Windows Firewall. Your antivirus will also have a firewall. Make sure it's turned on. You know, you can do several different things. If you have a business, you can actually buy a little box that is basically a physical firewall that you can install on your network, so nobody, you know, it's just another security measure so nobody can come in and, you know, steal credit cards or information, bank information, whatever the case is. Take a look at your QuickBooks or whatever they want to do. You know, the key thing here is that if you are plugged into the internet, then you're not real safe. You've got to do everything you can to make sure nobody can get into your stuff. You know, another thing you can do is change your passwords frequently. You like your network passwords. If you have wireless, you know, change it once a month is a good idea. Bank accounts, if you do banking and stuff online, change that stuff, those passwords once a month. So a lot of times what these guys will do is they'll find an account or whatever, and they'll run this program, and it just does all the passwords that anybody has ever done. It may take them a month, but eventually they can beat through it. So it's smart to always change your stuff. And I'm not trying to scare anybody, but have some security. Call a computer company. Have them come out, check out your business if you have one. Make sure you're secure. There's lots of stuff that can be done. But anyway, this is Isaac Rose from Reboot Computer Company, and that's the Reboot Tech Tip.
Thanks for tuning in today. Again, we're going to show you the dogs and cats that are available for adoption here at Walton County Animal Control. Remember, we're right behind the Sheriff's Office in Monroe. You can come by any afternoon, Monday through Friday, from 2 to 4:30 to have a look at what's in the kennel. Springtime's coming. What does that mean? Yeah, it means warmer weather, but it also means cats, 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 cats. Every spring we get flooded with cats and kittens, and there's just way too many to get into new homes. So what we need your help to get them spayed and neutered. Paradox Spay Neuter Clinic is starting up their yearly special, cat spays, only $25. So if you've got that female cat hanging around your house, you like her and don't want her to go, but you don't want a bunch of little kittens, just go to Paradox Spay Neuter Clinic, $25 during the month of March and I believe April. It's going to be at paradoxspayneuter@hotmail.com, or you can call 770-972-5067. Give us a hand here and get your cat spayed, and now we're going to show you some of the animals that are available for adoption.
We got a 4-month-old male cat that has not been neutered, but very sweet. He's still a kitten. He is very loving and very sweet, and we do have others also. You just need to come down and look and pick you one out. But he is very sweet, and like I said, he's 4 months old.
We got a hound mix, female. She's about 3 years old. She's already spayed and has a ton of energy. Needs lots of room to play.
Hey, this is Dozer, kind of a unique fella. He looks like a German Shepherd, but he's got little stubby legs, so maybe he's mixed with a Corgi or some kind of lowrider dog, not really sure. But he's a real friendly guy. He's played with other dogs in the kennel and hadn't been any problem at all. And he's already been here his time. No owner came forward, so he's looking for a new home.
We got about a 2-month-old male, possibly a Aussie mix. He's about 2 months old, very sweet and needs a home.
Yeah, this is Maribel. She's kind of your typical Georgia black dog. Not really sure what kind of mix she is, but she's a nice medium size. She's not going to get any bigger than that. She's got a real sweet personality, real gentle, should be good with kids as well, and she's done fine interacting with other dogs here at the shelter.
Here we have a mixed breed female. She's also spayed. She's about 3 years old, and she does not do good with cats, so she would need to be the only pet. She does get along with other dogs, but she just does not like cats.
Creative Signs, we make large and small property and business signs, full color, digitally printed banners, as well as vinyl lettered ones for celebrating special events. Yard signs for selling your home or making special announcements like your graduating senior. Turn your vehicle into a moving billboard with vehicle lettering or magnetics. Creative Signs, Monroe, 770-267-7368.
Fetch boy! Where did all this trash come from?
That was a good one.
Good game, man.
I heard each year that one person throws away enough trash to equal the weight of 8 baby elephants.
I heard recycling just one Sunday newspaper could nearly save 75,000 trees. Help your community out.
Keep Walton beautiful.
Keep Walton beautiful.
Keep Walton beautiful.
To be a Keep Walton Beautiful volunteer, call 770-267-1421 or more, check out our website at waltoncountyga.gov/KWB.